This episode is all about falls prevention, or let's talk about falls prevention. If you're watching this and you're in your 40s and you have a set of parents or grandparents in their 80s, 90s, or even if your parents just turned 65, this topic is superbly important for you. I'm not a physiotherapist, so I can't give you any clinical advice, what to do, what to watch out for from a clinical perspective, but surely I can talk to you about my experiences that I've come across on a regular occasions, almost daily, if not weekly. Why falls prevention is so important as we age. Now, as we age, it is published that on average there are about 400 individuals gets admitted in the Australian healthcare system due to falls. That's a huge number when you think about it over the course of 365 days. I did a podcast with the president of Physiotherapy Association Australia, Dr. Rick Dawson. And in that podcast, he kind of cemented the whole idea why falls prevention is so important. I'm quite passionate about it because my dad, as you probably heard in many cases, I use my dad as an example. My dad had a risk of trips and he had a fall in recent times, and my paternal grandmother had a significant injury from a fall. Now we have this interesting concept when we talk about falls that we think about that they're going to have a fall outside of the home, but in most cases falls will happen in the areas where our folks frequent the most. Because generally when we frequent to those places, we don't need any support or help or assistance, and bang, it happens. And when it happens, it is dangerous. Now, one of the key things that I've learned during my client visit, I've been tagging along with my nursing team and moving from door to door. And one of the key things that I hear my nurses ask, like, are you on a blood thinner? Because if you are, and if you have a fall and if you hit your head, it can be significantly important. So you can have a hemorrhage from a fall if you're on a blood thinner. So it is quite important that you go to the hospital. And I know most cases that I also hear this complaint a lot, where we don't want to go to the hospital, we just want to go to the GP the next day. Please don't. It is advisable from a healthcare provider, it is advisable, it is in fact highly recommended to go to the hospital, because in the hospital they can actually observe you. If your parents or grandparents are in that age group where they're in their 80s or 90s, and they're on blood thinner and they have other health conditions which I'm unaware of what they may have, it is highly recommended to go to the hospital, to go to the emergency and be under a health professional's care or under observation. Thus, if there's something may go wrong, we can actually identify that before it goes or turns into a wrong thing. Oftentimes, prevention is cure. It not only creates injuries, it also creates a significant loss of confidence. Now, in recent times, I've been lucky enough to seeing quite a few clients in their own home setting, and I've come across a few clients, those who are kind of scared to go out and about what they used to be doing. Even up till 3 to 6 months ago, they're probably going out and about. But due to a recent fall, they are now kind of cooped up at home. Now, when you sit down and have discussions with their family members or with their wives or the husband, you kind of figure it out that the loss of confidence is so much so, or the denial is so much so, that you don't want to experience another fall, because sometimes it happens to old school male that we don't want to be seen. Basically, if I talk about my dad, he doesn't want to be seen weak or he's ailing or he needs an aid. That fall will trigger that I am now in need of help. And that is a huge challenge from a generation who are seen as the alpha male, or they basically build this society, build countries effectively. They're the generation from the World War II or post World War II, so they have seen a lot, experienced a lot. So it's not an easy conversation with our folks to go, hey dad, hey mom, you now need help. You now need a falls prevention strategy. Now, Loss of confidence is one of those things that will stick out, and it will have a psychological impact if they are not getting out and about. And all of these things are happening due to falls. So you can understand that when I talk about falls prevention, it is not only that to prevent injuries, but there is a significant psychological impact to it. Therefore, folks, it is quite important, if we have aging parents, it is time to seek help through Support at Home program that is coming in July 1, 2025, or if your parents are part of Aged Care of Home Care, under these two programs, current and the future, your parents will have access to physiotherapy services where a physio can come into your home and do necessary assessments to create a plan how we can create a falls prevention strategy. Now, it is not a strategy that you buy it and it gets solved immediately. It doesn't happen that way. It is an ongoing strategy through ranges of clinical work the physiotherapist will be doing one-on-one or in a group setting, whichever works out, to create that and implement that falls prevention strategy for your parents, i.e., for an example, my mom or my dad. Now, one of those things that I've seen, that strength and conditioning, right? Why strength and conditioning is so important. Again, I'm not a physio, so please don't take medical advice from me, but I'm only advocating for physiotherapy services because my personal experience, and I can only vouch and talk about my personal experiences here, given the fact that my mom and dad are in that age group now, and they need physio. They are getting physiotherapy services in their home setting. And my clients under our organization, those who are with us for the past 10 months, we are encouraging all of them to have physiotherapy services for one perspective. It is basically, look, prevention is cure. Not only it will help you to be stronger and have a lot more confidence to live independently in your own home, but also we can reduce those hospital admissions and potentially live a life full of quality in our own home setting. Now, one of the key things that I also have seen that most people, there are now watches that we can wear, and that will have the alarm system where it will be connected to your loved ones or to yourself, as if something happens, you will know that your mom and dad or your grandparents just experienced a fall. And if they're under a package or a home care package, or may that be Support at Home, or even at a residential aged care facility, you will then be needing to contact your healthcare service provider, thus you can take the necessary steps and actions, take them to the hospital if you can access it. If not, at least call your care manager or care partner, whatever you call them, or to the residential aged care facility. I mean, if they're in a residential aged care facility, they're relatively safe because they have nurses there all the time. But if it is in a home setting, one of the key things that I will be recommending, that do not sit and wait. If you have learned that they have experienced a fall, please do let your service provider know right away, thus they can organize those physio assessment, a post-fall assessment with a nurse or a physio or an OT, come to the house and look around and see what are the things that the organization can do within the budget that is available, expertise they can provide to actually see how we can future prevent these falls. Talk to the GP, completely holistic approach, coordinate with your GP and understand, is there anything else is in there that is happening. One of the key causes of falls that happens within the female population is UTI. Now, I never knew this. I only got to know this ever since I started working in this industry. UTI can cause falls too. So ear infection, balance, these are the sort of things can also cause falls. And over the next few episodes, I'll be covering a little bit more in depth about what are the key signs and symptoms that happens with falls, because it is something is highly important, and I can't recommend enough to seek help. If you're not in a package, you can still go to a physiotherapist. Under Medicare, you get 5 physio services. Please don't be reactive for your folks, your parents. If they're not under a home care or a Support at Home program. They may be under Commonwealth Home Support Program, which is otherwise known as CHSP. They can also access physiotherapy services under that funding bracket. If not under Medicare, they get 5 physio visits, and you can certainly go to your GP and go like, look, my parents are now 70 years old, they're not part of any packages, can we just go and do an assessment? Oftentimes, working with the physiotherapist will do you more of a good than not doing anything about it and then experience it all and then figuring out like what to do next. As we age, it is not only important for you today or for your parents or grandparents today, it is also important for us, those who are in our 40s, to actually proactively work on that. Thank you for watching and have a splendid day.